Good evening, viewers. Welcome to this week's episode of BAMC Global Live Al Hilal Health World, Nothing But Lifestyle. Myself, Adya Mahipal, and here we are in another episode of Health World, Small Steps to a Better World. So today's topic is journal surgeries. And for that, today we have Dr. Nusrath Jabeen. She is a specialist in journal surgery. She currently works in Al Hilal Hospital, Muharraq branch. Welcome, doctor. What is your experience in journal surgery?
My experience in general surgery is now almost 14 years.
Okay. What kind of surgeries do you do, and what is your experience in them?
I almost perform all kinds of the surgery, general and laparoscopic also. There are systemic wise actually it is the surgeries, like some are neurosurgery, some are other surgery. In a general surgery I can perform like intestinal surgeries, hernias, gallbladder, breast, thyroid, all those I can perform and all that.
So when should a woman get checked her thyroid or breast surgery?
See, this depends upon the symptoms and this depends upon the history and all that. Let's take the breast first. In the breast, if a female reaches up to the 40, and she should get screened. Now, it was before 45. Now, even in some countries it has reduced it to 35. But at least at 41, she should be screened with a mammogram ultrasound. But if a family history is there of the breast cancer, it is mandatory to get her screened after 40, even after 35 now. So, for thyroid, there is no screening actually. It depends upon the symptoms. Like she is hypo or hyper, like hypothyroid or hyperthyroid. There are different symptoms. The hypo have fatigue, and they are lazy, they have tiredness, they always feel sleepy, they have constipation, they have weight gain, and it is opposite to that hyper. They have tremor, they have palpitations, they have weight loss, their eyes sometimes big, they have like lower ankle edema and all that. So when these symptoms come to both and other all which cause these are normal, one should get one test and TSH level and check whether it's hypo and hyper. Besides that, if any age consideration for that feels he has enlargement of that thyroid gland, he feels here it's not normal, something abnormal is going on, he should go for the ultrasound and check it.
What are the side effects of these surgeries?
Actually, there is not a side effect. Side effect is for the medicine. For us, it is the complications. Every surgery has some complication and all, but it doesn't mean every surgery will develop the complication. It is very rare. Let us take the breast surgery and thyroid surgery, as you said before. The breast surgery, the immediate complication is the bleeding, and also after post-op, it is again the bleeding, infection of the wound. And sometimes what happens during this breast surgeries, if it is a total mastectomy, not a small, like not fibroadenoma, let's take a cancer. Sometimes we cut the many nerves inside, so that may cause the loss of sensation in her arm, pain and all that. So in the thyroid, there are two main dangerous complications, immediate and later. Immediately, again, if it is a bleeding here, it can compress his windpipe, we can say, airway. So patient may go into the coma, hypoxic brain damage and death. And later there is one nerve through which helps us in speaking actually to generate your voice. That's called a recurrent laryngeal nerve. It's on one side and other side. If you cut one, it's the hoarseness of voice, the low pitch voice. And if you cut both, patient will go. So both the complications of the thyroid are dangerous. In the breast, although we can manage the hemorrhage after, can take patient back to the OT and this, but thyroid you need to be very cautious. This is the dangerous complication.
Can you tell us something about hernia surgery?
Hernia actually is the patient presents with swelling like a lump. It is actually your contents inside coming out as a outpouching like that. So when patient comes with, there are two types of surgery in the hernia, means where patient can go for the surgery. Once patient willfully comes that I have a swelling, I don't have pain, I don't have vomiting effects, but I want to get rid of it because it is in his mind I have something here. Other patient ignores it because he doesn't have any symptoms. Most of the patients who brings to the patient to doctor, this is the pain. So most of the patients, like 80%, ignore it as a swelling, but it doesn't give me anything, let it be. So when he starts the pain, that means already it started complicated inside, sometimes obstruction, sometimes adhesion, sometimes whatever, and that time patient comes for the surgery. In both ways, it needs a surgery.
How long does the surgery take?
Depends upon the expertization of the surgery. Usually it takes 45 minutes to 1 hour maximum, but if it is uncomplicated. So at the end, it depends upon the surgeon, how fast he is, how expert he is, and how experienced he is. So it depends on all that.
What is the intestinal surgery and when is it needed?
Intestinal surgery means surgery in the intestines, systems of God. So it needs when it gets affected. Like let's take a simple acute appendicitis. It is a vestigial part of the intestine. When it is a pain and you are doing ultrasound and all that and CT whatever it is showing you how to do. Sometimes intestine, usually here in Middle East old age people, they take a lot of their CTs and all that and it makes like a ball called its vaso. It is stuck at one point of our intestine, it obstructs about that. So that times one more disease is called it interception, that one part of gut stuck in the other part, it cuts open that time. Sometimes it has an adhesion inside that time. So whenever anything happens which is not resolved by conservative management inside the abdomen needs the surgery.
What are the long term effect of this?
There are depends upon the type of surgery. It is simple adhesion, you cut the adhesions and all that. The long terms only he may develop again. But if there is a resection means it's the gangrenous bowel or you need to cut a long portion of the small intestine and which part of small intestine which is important. So patient develop one syndrome called a malabsorption syndrome because every part of our has some function to do. No, it is also the function of absorption of our nutrients and everything. So he has those deficiencies he develop. So and he may develop again obstruction later. Because while you resect and anesthesia, there may be stenosis, narrowing may happen and it may develop again. So these are the, and sometimes after resection there may be leak also. That's the immediate effect. And these are the effects of this intestinal surgeries.
So we talked about many surgeries now. So can any of these be solved by medicine?
Surgery is surgery. There is no conservation. But we take, let's take a small surgery that's called the appendix. Sometimes we call one term there is called Catalaral Appendicitis. When the inner lining that's mucus only inflamed some that time you can take, and other parameters are normal, which are like in the appendix to diagnose, we take clinical judgment, we take laboratory judgment, we take radiological, if radiological and all that, only clinical is suspicious, but radiological laboratory is not giving you that much kilo, and you feel it like that time you can take chance to give the patient antibiotic. Otherwise surgical is surgical. When this patient needs surgery, that he has a surgical problem, he must go for the surgery.
For any problem, what is the right time for a surgery?
When it reaches to its peak, but a surgeon should be so much experienced and not allow it to reach at a peak. Peak means already everything is gone in your hands, that there is no weight. For example, let's take the simple appendicitis. You are seeing that yes, there are symptoms of appendicitis. Laboratory is little high, they are giving indications that something is going on. Radiologically, it is also, you should not wait till this perforate and cause peritonitis and gangrene till its complications happen. So right time is when there is a minimal level of damage, not the maximum you wait. So better to take decision at the minimum level, not at the maximum level, even not at a mid level. But the only you should be 100% confident and knows that yes, this is the problem going on, not a trial.
So you are doing circumcision surgeries also. So what is the right age of it?
Circumcision right age is even on the first day. So there is no right. Actually, usually should done below 1 year. So not because you cannot do after that, you can do it, but it is the anesthesia. Below 1 year you can do under the local anesthesia and all that. After 1 year you need to anesthetize the baby because of lot of movements and all that he cannot be. And otherwise right time is even after the birth. From here you can take from here for circumcision. No, there is no any right time for it.
Can serious complication occur?
In what, circumcision?
Yeah.
Yes, of course. Again, I will come to your expertization of surgeons. If he not identify properly that foreskin, he may cut the glands, the portions. And after some babies, they develop the necrosis because nowadays they are putting that belly ring. The ring is too tight, necrosis can happen, no blood supply and this. Sometimes wound infection happens. So there are, but they don't come usually. They are rare, but everything has complications, but rarely.
Does the child need to be circumcised?
I cannot say about all childs. It depends upon the religious. Yes, religious indications are in every child who is there. This and others indication, disease indication. Like some they have the foreskin is very tight, and some when it goes the skin and it doesn't come, some diseases are there in the in skin of that around that glands which need a surgery. That is that. Otherwise, religious, yes. For I think Christians and Muslims, they need it. Yes.
Okay. We have seen and heard that gallbladder pain is terrible. Does everywhere who have pain need to get it removed?
See, pain doesn't mean that it needs to be removed. There are indications for removal of gallbladder. Yes, of course, the pain is indication something is going in the gallbladder, but not pain and let's go and take the gallbladder out. You have to investigate the patient. Pain can be from any other reason also. So yes, you have to see inside gallbladder what has happened. There is 2-3 things which is going on in the gallbladder. First of all, let us take the common stone. Yes, of course, you need to remove gallbladder after pain settles, which is called acute calcular cystitis. There are 2 ways. Whether you take when patient develops a pain and you are sure there is a calculi, take within 24 hours, remove the. If you delay beyond the 24 hours, don't remove. Wait till this infection resolves, then yes, it needs. Some gallbladders have polyp, which is like a meat inside, and we have to see the size of the polyp. It is going more than 1 centimeter. Yeah, there is a risk of change of transformation into something. You need to take it out. Some other indications like we call it cholesterosis, porcelain gallbladder. There are many indications. So every pain doesn't need. You have to show indication whether it is. You should have some proof for which you are going for the we call it cholecystectomy, gallbladder removal. So for pain, only pain, and we will take gallbladder out. No.
Are there any side effects of this?
Again, I will say there is no side effect, there is a complication. Yes, there is side effect actually in the gallbladder. When you remove the gallbladder, actually it helps in our digestion, main thing. So patient develop bloating now after removal of gallbladder. They always say we have bloating, we have indigestion problem. These things remain for some time till they acclimatize with all that. So complication as surgical complications, like there is one major structure that's called a CBD, common bile duct, which takes the whole bile from the gallbladder liver towards our down part. Yes, if anybody can injure it, and it is dangerous that time. And there is one more important that's called a portal vein. Some people cut that also injured. So these are the surgical complications. Yes, side effect for gallbladder, yes, post surgical there is.
Is there any other surgeries that we have not talked about you do? Can you tell about that?
Yes, actually, besides the general surgeon, I have some experience in gynae also. So I have done many ovarian cystectomies, ligation, hysterectomies, and I'm still keeping my interest in that. Whenever anybody needs help and all that, I poke my nose. Okay, I'm here. So I am. Yes, I am.
Hemorrhoid is another surgery. At what stage is this surgery needed?
See, hemorrhoids actually it's we call it internal pylorus also. Most of know in many of the patients call it as a bawasir. So it has a grades: grade 1, grade 2, grade 3, grade 4. It is internal hemorrhoids, external hemorrhoids. Usually external hemorrhoids we need surgery only for the cosmetic purpose. Internal hemorrhoids, yes. Grade 1, grade 2, no. We manage it conservatively. As you said in the before, there is any surgery which you can conservatively. Yes, hemorrhoid is that where we can give the chance, we can give the medications to reduce its size. What is it? Is the actually dilatation of that anal cushion. There is a vessel small with the pressure during pregnancy, especially most of the female, or because of constipation and all that, it develops. So that time, yes. In the third, we are taking the chance 50-50. If we are trying the conservative management medicine, if it is reduced, yes, it is size, and patient is complaining that there is no bleeding now, there is no, some patients have hemorrhoids with fissure, because cause of hemorrhoid is constipation. Constipation first will give fissure, then it will give hemorrhoid. So if patient tells no, I am now, so we can give him chance to wait. But 4th degree, totally out, straightway surgery. There is no need, there is no any chance of conservative management in hemorrhoids. So it depends upon the which grade patient have.
Thank you, doctor, for joining us today. Hope you found this episode helpful and informative. Now we'll see you in the next episode, same day, same time. This is Sadhya signing off. Good night.